Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hafide and welcome back. Tonight we are talking about food allergies, specifically peanut allergies. A life-threatening allergic reaction can make someone feel sick in many different ways. While the symptoms of an allergic reaction can vary from person to person, reactions can become quickly progressed into a life-threatening situation. And joining me as always is ExpressCare's Dr. Jitka Lom.
Hi,
Welcome,
Joni. Nice to see you.
You too.
Thanks.
So let's get straight to it. What is anaphylaxis?
Anaphylaxis is a life-threatening allergic reaction. You can recognize it because it happens usually within minutes, sometimes even within seconds, usually of eating a food, or sometimes like a sting of an insect like a bee sting. But anaphylaxis can occur in the specific case of peanut allergy by eating the peanut, and then the person will suddenly start turning very red, start to get very itchy, their eyes will start tearing, their throat will start feeling like it's closing up, and they're choking, and they'll start wheezing, having difficulty breathing. Then their blood pressure will start dropping, in which case they start fainting and passing out, and if nothing's done, they will actually die within a very short period of time, 15 minutes, sometimes up to 30, 40 minutes, like that. So it is very quick, and it's really important to know what to do and how to recognize it.
Okay, so are there any tests to determine whether or not a person has a peanut allergy?
Sure. Most of the time, peanut allergies are discovered by the oral test, the ingestion of the food. You eat the food, you break out in a rash, that's how you know that you have the allergy. But let's say that runs in your family, or you just want to know. You can actually have a blood test done that will tell you about peanut allergy, or you can have a scratch test done where the doctor will place a tiny little bit of peanut allergen into your skin and see whether you react by getting a red irritated area. The blood test tests for 10 different components of peanut allergy, because actually peanuts have 10 different proteins that you can react to. That's why some people's peanut allergy is really severe and life-threatening, because they're allergic to one component. Others might just have a mild reaction.
Okay. Now, you mentioned earlier that a person can die from a peanut allergy. Now, but you did also mention that there's different severities to a peanut allergy. So can you share with us, is it possible for someone to still eat peanuts even though they're allergic to peanuts, or will they go straight to?
And that's a super question. It's called peanut intolerance, right? So you can have intolerance, meaning you eat the food, you feel like a little scratchy throat, you might break out in a mild hive, you may just feel itchy in your mouth even. That's a mild intolerance. You probably shouldn't push it and keep eating peanuts, but there are those who will just have a small taste, or even have peanut be sort of like residue of peanut be in their environment, and they'll start wheezing and tearing and all of that. So the degree of severity is large, and there's no way to predict. And so I think if people suspect that they have an allergy, they should certainly avoid the food.
Okay, now why is it that more people are prone to peanut allergies as opposed to other nuts like almonds? Does peanut allergies exist in all countries?
Yes, those are also great questions. So peanuts are actually in the legume family. They're more like soybeans and peas and other vegetable or other plants in that category, meaning peanuts grow under the ground. They are different from tree nuts. That's almonds and cashews and those kind of nuts that grow on trees. Peanuts actually grow within the earth. And so they're completely different, but there is a cross reaction. So some people with a peanut allergy will have about a 40% chance of reacting to other nuts. So most doctors will recommend, if you're allergic to peanuts, avoid all nuts, period. Although you may be okay with some of them.
Okay, now is a peanut allergy related to other allergies?
Yes, to soy. If you're allergic to peanuts, you're more likely to be allergic to soy, and again to some of the other things in that category, such as beans.
Okay, now we've covered peanut allergies. Now let's talk a little bit about dealing with an allergic reaction. What do you have here in front of us? I know that's an Epipen, but can you share exactly what it is?
An Epipen has this is the package, and this is what it looks like. An Epipen has epinephrine in it. Epinephrine, the other name of that is adrenaline. This is the hormone that is made by your adrenal gland. That's the little gland that sits on top of your kidney. When you're stressed, severe stress, such as an allergic reaction, that's a severe stress on your body, your adrenal glands will pump out a lot of adrenaline to help you cope with that and not die. Now, to help you, you can purchase the Epipen. And the way that it's used is basically you pop off the top like this, the blue top. Let's say you get a bee sting, or you just ate a peanut and you know you're allergic. You pop off the blue top. There's a plunger here. You put it in your thigh, you plunge it down, and you give yourself a shot of epinephrine, which is the same as adrenaline. Your body then will recognize that as something that's helping it fight that terrific stress of the allergen and help you survive. So this is actually a life-threatening condition, anaphylaxis. When you use the Epipen, you are doing a life-saving measure on yourself or that other person. So it's a very, very important thing for people to have around if they have bee sting allergy or peanut allergy or other serious allergy.
Okay. Now, in the movies, we always see, when we see Epipen, we see them plunging it into the heart, right?
Right.
So can you share with us the do nots?
The do not plunge it into your heart or into your neck. I've seen that in a movie too. No, Epipen belongs into the subcutaneous tissue. That means into the fatty tissue, because that's where you have a lot of blood circulation and the needle's very short. We never plunge epinephrine into hearts or any other part of our body, just into under the skin. And it's actually impossible to do it wrong. Basically, you put it on any part of your body, press the plunger, and that's it. And is it terribly painful or agonizing? Absolutely not. It feels like a tiny insect bite again. And then the person will start to feel better almost immediately, within seconds. Within 30 seconds, their reaction will be reversed. They may feel a little palpitation, a little bit of a rapid heartbeat. They may get a slight headache from it, but they will immediately start feeling better. And you can do that on the way to the hospital, because some people, when they reverse this allergic reaction, about 25% of people within 24 hours will have a second reaction to that allergen. So you think you're in the clear, but you're not really in the clear for about 24 hours.
All right, thank you so much, Doc.
You're welcome.
Well, don't go anywhere, because when Healthy Living returns, Dr. Jitka Lom takes some of our viewers' questions.